I was working as a veterinary assistant. I saw animals being dropped off at the office. I was the one holding them as they were getting an injection. They were scared. It was, we weren't doing a lot to help the clients through all of that end of life stuff. And I thought, why are we having this experience with humans and not this experience in vet med?
That is Dr. Lynn Hendrix, a veterinarian specializing in palliative care. And this is the VIN Foundation's Veterinary Pulse podcast. I'm Jordan Ben-Shia, VIN Foundation's Executive Director. Join me as we talk with veterinary colleagues about critical topics and share stories. Stories that connect us as humans, as animals, as a veterinary community. This podcast is made possible by individuals like you who donate to the VIN Foundation. Thank you. Please check the episode notes for bios, links, and information mentioned. Hey all, a quick heads up that some of the content in today's episode may include a trigger as it relates to personal loss and pregnancy. As a reminder, if you are a veterinary student or veterinarian, the VIN Foundation's confidential support group, Vets for Vets, is here for you, and you can find information to reach out in the episode notes. Please know you are not alone. Hi, Lynn. Welcome. Thank you for joining us today.
Thank you for having me, Jordan. It's great to be here.
Well, I'm really excited to discuss this topic because I think it's going to be something that we definitely haven't covered yet in the podcast. And, whether we like it or not, life and death are two certain aspects of everything that all of us deal with, right? Both humans and animals. And so I'm looking forward to having the conversation of how we help those that we love, the beings that we love and cherish, as they get towards their, elder years, shall we say.
Yeah.
So let's start by kind of learning about your journey and your story to veterinary medicine. So were you one of those kids that from an early age thought, yep, always going to be a veterinarian. I love puppies and kittens, and this is just for sure for me? Or was there more sort of an aha moment for you?
Great question. I was the kid that was drawn more towards animals than I was people. People, I think, early in my life disappointed me a lot. And so I found, the thing that a lot of people find with animals, and that is that unconditional love.
Right.
I was interested in being a veterinarian because those were the people that took care of animals. And so helping animals live long and happy and healthy lives was something I was interested in. And of course, I was the kid that read James Herriot, thought it was all about being James Herriot, wanted to be James Herriot. And then, as I got older and read more things, it was really a book that I read later in life called If Wishes Were Horses by a veterinarian named Loretta Gage. And it made me want to go even more. That particular book is about vet school. Mostly it's about, getting into vet school, going to vet school. And so when I was trying to get into vet school and failing miserably at it, I that really was kind of my guiding light of, if she can do it, I feel like I could do it. And it just really drove me.
That's wonderful. It sounds like that's a story that we often hear from colleagues, that it started with really, they either had a pet that they really loved and wanted to care for, or they just found this sort of true unconditional love in the being of an animal that provided them, was really like their heart animal to begin with.
All of my animals were that. Whether it was a
Yeah.
hamster, a dog, a cat, it didn't matter. I loved them all. My parents found me standing underneath a horse when I was 2 years old, petting its belly. I had like
Oh.
toddled down the street, back in the days when people had horses down the street, and
Right.
they couldn't find me, and that's where they found me, is underneath this horse. And of course, I
Oh,
don't
that's
remember
so
that, but
cute.
that's a story that gets told about me a lot. Um, so
That's very endearing. So, what was your first job out of veterinary school? Obviously, you wanted to be a vet. Your path was
yeah,
that, and where did it take
I
you?
because I am the person that I am. I jumped right into emergency medicine. Um,
All right, just go right in there.
I like to challenge myself, and so
Mm-hmm.
and I had worked in emergency medicine prior to vet school, so I had several GP jobs where I was an assistant, veterinary assistant, and then I my last job before vet school was at an emergency clinic, and I loved it so much that that was my plan going into vet school, and my plan coming out of vet school. Although part of my plan going into vet school was also about hospice,
Mm-hmm.
but there wasn't really any organization, etc., set up at that time. So my plan was always emergency medicine coming out, because it was a
And
challenge.
so,
Yeah,
mm-hmm. And so, did emergency medicine draw you in because of the challenge?
yeah, yeah, and I will maintain this to this day. It fed my brain, but what I learned after about 10 years of doing it is that it didn't really feed my soul, and
Mm-hmm.
that is. That's where I needed a shift in my way of thinking about veterinary medicine. I had a job that was so bad that I almost left veterinary medicine altogether, and uh, and that's kind of how I got to where I'm at.
Wow. Okay. And you mentioned that you were interested in hospice going in. Where was that? Where did that interest grow for you, or
So I
how did that start?
my mother who raised me, I'm adopted, so I have to clarify that, because then people meet my other mother, my biological mother, and go, but she's still alive. Um, but the mother that raised me died in
Right.
1993, and of lung cancer. And it was my first real experience with death, and
Mm-hmm.
dying, and hospice, for her. And I and it was because it was my mother, a very and she was my best friend, and I maybe my only friend at that point, because I'm kind of an introvert. It was really hard. It was really hard death,
Mm-hmm.
and loss, and the hospice people made it worth living for me. They
Yeah.
helped me, in ways that they probably don't even know to this day. They kept me from following her. I had a lot
Mm-hmm.
of complicated grief after her loss. And once I kind of came out the other side of all of that, um, I thought, I was working as a veterinary assistant. I saw animals being dropped off at the office. I was the one holding them as they were getting an injection. They were scared. It was,
Mm-hmm.
we weren't doing a lot to help the clients through, all of that end of life stuff. And I thought, why are we having this experience with humans and not this experience in vet med? And even then, I
Mm.
was planning on going to vet school, um, and I thought, well, we really need to change up what we do in veterinary medicine. I so so that's kind of my journey there, I went to my vet school interview in 1998 talking about hospice for animals. And everybody there was intrigued. They were like, this is kind of mind-blowing stuff. What? We've never heard of this before. And so after my mother died, after I got through my complicated grief, I started studying because that's kind of my forte of being. So like, I get interested in something, and then I just go research it like crazy and go to the library. Now we can do most of that stuff online, but at the time I would go to the library and I'd look stuff up. I'd get on the internet, whatever it was in 1996.
Right. AOL.
I think we were past AOL. I think we had Netscape and some other things.
Right. Yep. There was Netscape. I remember that.
So, I started looking up animal hospice. There was really nothing out there. Nobody was really talking about it. Nobody was really doing anything in that realm. The first person I found that had any information on was Eric Clow in, I think it was in Pennsylvania. And I think he gave the first lecture that I can find in I want to say it was 98 at AVMA, titled something about animal hospice. I don't remember what the exact title was, but that was the first internet information that I could find. There was nothing in writing. Nobody was writing about it. And of course, there were other people doing things. Alice Villalobos was down in Southern California, kind of starting her hospice experience. There was Amir Shannon in Chicago, who Tammy Shearer in Tennessee. I think she's in Tennessee. I mean, so there were individuals, but nobody was really going onto the national stage. There was no organization, nothing at that time. So when I came into the vet school interview talking about it, people were just blown away. Like, so tell me more about this. And honestly, I didn't really know what I know now.
Right.
A lot of people thought that, and still, this is one of the myths that are out there, that hospice and euthanasia are the same thing, and they're not. So that's kind of where I stepped in. And then there was a Nikki Hospice Foundation was founded, I think, in 98 or 99 by Catherine Maraschino, who's a professor at a university in California. And she's not a veterinarian. She's a layperson who had a traumatic end-of-life experience with her cat named Nikki. So she wanted to start an organization that could develop education for veterinarians to better the experience for clients. So she comes at it from the client perspective. So once I got into vet school in 98, and I was a student member of their organization, and I want to say 2000. I think it was my junior year that I did that. 2000-ish, 99, 2000, somewhere in there. So that was kind of my early experiences with animal hospice.
Wow, what a story. I mean, that must have been very rare for a veterinary school to have a student coming in saying they wanted to focus on end of life, right? Versus that's not the sense I get from a majority of veterinary students, that they come into veterinary school saying, I'd like to discuss end of life, right? But that, kudos to you for exploring that and wanting to dive into it further. And so where is that? I mean, I'm going to say passion because it sounds like it's a passion of yours. Where has that led you to now, and what is your current role in the veterinary profession?
Yeah. So, as I said, I went in to my interview talking about animal hospice. I came out and became an emergency doctor. So I've got processed through, and really, it I was in emergency medicine for about 10 years. And I had a bad job, really bad, psychologically damaging bad. Thought about leaving the profession altogether because, people threaten to kill you and all sorts of nastiness. Not only that, but the system, the place that I was working, the system was broken. The management was bad. They were accusatory. Rather than team building, it just was all around not a great place to work. They hired people to tattletale on other people. I mean, it's just, yeah, it was terrible. I had a miscarriage. That's probably too much information for the audience, but and they talked about with me on the phone about firing me because of staying home for a miscarriage.
Oh my gosh, Lynn. Oh my gosh.
Then they asked me to. They were opening up to be 24 hours, and they asked me to come and do an extra shift. I was working weekends, and I had a small child at the time, and they asked me to work an extra day, and I said, give me 24 hours, and I'll let you know, and if I can make arrangements to do that. And 24 hours later, it was February 20th at 2 p.m. Funny how I know that. In 2011, that I called in to say, sure, I can do that. And then they read me how I sucked as a human being.
Oh my gosh.
Like, what changed? What changed 24 hours ago?
Right.
That was weird. And so I went to work that weekend and started writing a business plan in my off time, not while I was working.
Right.
But that's kind of how I shifted my focus of emergency medicine to what is my passion, obviously, because here I am talking about it and writing about it and such. And so that is really kind of where I jumped onto this where I am at.
Wow. I know that you said it might be too much to share with the audience, but I know that there are many people that have struggled with similar situations. And I think that you sharing that and being willing to be vulnerable about that and have the courage to discuss it, I really applaud you because it'll allow others to feel more connected and not as alone, right?
Thank you.
And I can only imagine how phenomenally challenging that must have been to be in that position and to have beyond no support, just unkindness at that point from the employer who really, legally definitely can't say that, let alone just as a human, not, wow. I wish I don't know what to say. I'm very, very sorry that you went through that experience.
Oh, thank you. Thank you. I mean, we all go through these kind of experiences. It varies. What kind of traumatizing things human beings do to one another. But, one of the things that I learned with my complicated grief, and one of the reasons why I could go in after that conversation and still work, was that we can move through it. We have to feel those feelings and be present and do that work. But we can, life continues and grief continues. Grief doesn't go away. There's no end point to grief. It is with
Right.
you. It changes you. It shifts your world. And so, every time that you experience a loss of any kind, you can have earth-shattering shifting, or time shifts, so to speak, different tracks that you go on, or they may be a little thing. I mean, for me to lose a car used to be life-shifting loss, because I get attached to everything, including my cars. But some people can zoom out cars left and right. I mean, it's just what they do. So, if I lose my phone, it would be a life-shifting thing, because I'm married to it. But losing a baby is one of those life-shifting events, and people don't realize how hard it is to have a miscarriage for women. We could go into what's going on in the world right now in the United States, but I think we'll shift back to palliative medicine.
Okay, we'll shift back to palliative care. So for the audience members that, might be new to this concept, can you help us understand, for our listeners and myself as well, what's the difference between euthanasia and palliative medicine? And, what's the difference between palliative medicine, palliative care, hospice, and how does this all parallel with the human medicine? Because you mentioned hospice before, and I, for whatever reason, have a lot of experience being with people that I love going through hospice. And so I know that pretty well from that experience, but I don't, I haven't experienced that from an animal perspective. And so I'd love if you can kind of share with us some insight into what those differences are, how they're sort of defined, and how we can kind of, I think us as humans, we understand hospice because we're engaged with it, right? But if hospice is from an animal perspective, we might not know exactly what that means. We could presume, right? But I'd love to kind of hear from you some more about the differences between those.
Right. So I'll start with euthanasia, because that's what probably most of the people in the audience is familiar with or have some experience with. Euthanasia is about the end of the life of the animal, and that's it. Euthanasia is really just about how they leave this planet when they die. People tend to think of euthanasia in lots of different ways. It's defined as good death, etc. But essentially, there are a lot of ways for people and animals to leave the planet, as I like to call it. You can be eaten by a shark. You can be blown up by a terrorist event. We could die peacefully in our beds. I mean, lots of different ways to leave this planet. Most people think of going to sleep and not waking up is the optimal way for human beings to die. Well, most people think that.
They probably think that because they think that that's the least painful.
Right. It's essentially a heart attack, but you're just not conscious and aware of it. So your heart stops, and people find you passed away. There's actually a study out there that they asked people, what's the optimal way to die, and 90% of people said going to sleep in their beds. 10% said no. I'm not sure how else they want to go, because they didn't go into that detail in the study. But I've actually talked to clients about that, and most people who are in that 10% say that it is they want to be awake and aware, and surrounded by the people who they love. And so, to me, euthanasia is about that. To be able to allow the animal to be surrounded by the people they love, be awake and aware, and then fall asleep on their bed or in a lap, and just pass away there. That to me is a good death, and that's what we try to accomplish. So that's what euthanasia is. It's just about the how of death. It's nothing else. It's about the how. Palliative medicine is really the study of medical intervention that creates comfort and gives education and support to the family and caregivers. So it creates comfort for the pet, and it gives education and support to not only the pet but to the family that's taking care of those pets. Palliative medicine is mostly for chronic progressive disease and terminal illness, and palliative medicine is also about the education and practice for the medical provider, so the veterinarian in this case. In human medicine, it would be the medical doctor. Palliative care, on the other hand, is similar, but it's more about the team effort that goes into the dying patient, the caregivers. So the nurses that are involved, the social workers, mental health providers, pharmacists, groomers in the case of a dog, or hairdressers in the case of a person. I mean, whoever can come into the person or the pet's space that can help them and help the caregiver's family take care of that patient is what palliative care is about. That can be provided, both those things can be provided early in the disease. So that if your animal gets diagnosed with osteoarthritis, you can start palliative care then. And you should. There's a study out there, Jennifer, I've called her Tamel for a long time, but I just heard her on a podcast and it's actually Timmel. Jennifer Timmel did and had a group. She's an oncologist who is also a palliative medicine specialist. And they did a paper back in 2010 in the New England Journal of Medicine that showed that starting palliative care early in the disease process not only made people live better, but they lived longer. And that is certainly something that I have seen. I know other colleagues have also seen that with patients. I mean, I'll give you an example. I've had patients with hemangiosarcoma, which usually, statistically speaking, has, whether you do surgery or not do surgery, has a lifespan of 1 to 2, possibly 4 months with surgery. So it's not a long-lived disease, statistically speaking. But I've had patients who've gone 10, 12, and I had one that lived 20 months. And the one that lived 20 months not only had, it was diagnosed at the university, he had tumors in his spleen and his liver and his lungs and his lymph nodes. At diagnosis, we thought they got told 1 to 2 months, so they opted not to pursue anything further. And they called me in, and then he just kept going and going. And he had 19 and a half really great months. Occasional day off of bleed, and then he would bounce right back and be going full steam ahead again. And so, those are outliers. Those are not the common ones, but we don't know who's going to be the outlier, who's, going to live longer. So I think just with palliative care, this dog lives a long, long time, and he also lived really well for most of that time. He started going about 19 and a half months into that 20-month period.
Wow.
So animal hospice, which is, the hot topic these days, and there's an organization that I used to be part of, the IAAHPC, which stands for the International Association of Animal Hospice and Palliative Care. We wrote the first guidelines. AHA picked up guidelines with the IAA HPC and wrote shorter guidelines. AVMA has guidelines, so there's some guidelines out there, but we were the first ones to really write about that. It was produced in 2013. I think they've updated 1 or 2 times since then. We talked about what to call, because we were kind of on the hospice focus. Animal hospice is really just the end stage of palliative care. They opted for animal hospice. I'm an advocate for veterinary hospice because then you're going to have medical professionals involved. I think if I see this these days that there are people who are getting certified who are lay people, no medical experience whatsoever, and they're doing things for people that may or may not be useful at all. But people don't know that there's a difference between, animal hospice, which is just about the animal, and veterinary-based hospice. It should be veterinary-based because you need to have medical professionals involved in the intervention of the animal so that they don't have pain and suffering.
So when you say veterinary hospice, is that what you're talking about when you talk about evidence-based medicine playing a role?
Well,
or how does that, if you can help untangle that for us?
Yeah, so evidence-based medicine is basically what science is based on, what medicine's based on, which is science. So evidence-based means that studies have been done. They should be double-blinded with controls, and have peer reviews and things like that to make sure that there's not internal bias involved in the evidence, and that the conclusion isn't based on our own internal biases, and we all have them. I could create a study where I said, the sky is blue, and then I would go out of my way to just prove that. Or, maybe I said the sky is green, and I would go out of my way to prove that, rather than looking at what the wavelengths were and such. So that's what an internal bias would be. If I decided, if my perception of things was the only perception, then, and I didn't see blue, I saw green, I would see it as green. So internal biases are based on our personal perceptions. We really need to have evidence base for any medication, any therapy that we're giving, and that way we hopefully make sure that they're A, not harmful, or B, doing something for the pet. So frequently we have we can all jump on the bandwagon about something, and that's where that internal bias belief system comes in, or we try something out, right? There's something that could be tried out, and then the evidence shows that that probably doesn't work in the way that we thought that maybe it did work. COVID had a lot of that going on, because the whole world got to see science in real time. We were all sort of the petri dish, so to speak, with COVID.
Right.
And then, had the conversations around what works, what doesn't work, and, the evidence of whether those things work or don't work. So looking at the peer reviews and the evidence. And I think that should be the case for everything. Well, I think where people get confused, and especially with COVID, is that if you're looking at an experiment in real time, which was essentially what COVID has been,
right? We're just living through this experiment day by day.
Everybody is using their internal biases and belief systems rather than looking at the actual graph. Did this work? Did this not work? And so that is where it gets confusing. And science finds different conclusions. And part of the reason why science finds different conclusions is because our internal biases get involved in some of our findings. So that just happens. So that's I think any therapy, anything that we do, especially for end-of-life patients, should have an evidence base. And that's not to say that I don't think outside the box. I mean, I have a book coming out where I looked at everything that I did in the medicine section is I looked at what do they do for human beings for this particular thing, situation, etc. And how could I translate that into veterinary medicine? So if I found that they used a particular drug, I'd look in the veterinary literature about whether or not we have ever used that drug before for that particular thing, if it was found to be or not be, and if it was found to not be useful, then I would drop it, and I wouldn't write about it. If we'd never used it before or for that particular reason, and then I would go actually on VIN and other places and ask internal medicine specialists or oncologists or whatever specialist if they had ever used that particular thing, so that I would try to get some peer review even before I wrote about it. If I couldn't find any reason why we couldn't use a drug, I'd include it and say more studies absolutely need to be done, but here's something they do in human medicine. Maybe we could consider doing it in veterinary medicine.
It's interesting. It sounds like, the real trick here is that us as humans, depending on what disease we might have or what we might be struggling with at the end of life, we tend to have the free will and capability to express and communicate what we want, right? And what's working versus not. And obviously, animals don't have that advantage, right? And so, hospice in humans versus hospice and palliative care in animals, drastically different because of that. And so you're really left trying to assess based on really needing to be extremely observant of the animal, right?
Yes. It's funny because I just gave rounds at UC Davis on kind of that very subject, The title of the rounds was "What is Suffering?" But we talked about observation and perception because, how do you make these judgments? How do you determine pain? In human medicine, they have a saying, pain is what the patient says it is. If I think pain is 10 and you think it's 1, who's right? The person experiencing the pain.
Exactly. Let's go with the one experiencing it. And that's tricky because especially for small animal, right? Cats and dogs are both really good at, hiding that pain.
So it's not so much that they're good at hiding it, it's that they're subtle about it. That the observer is actually the issue here.
Well, obviously, it's of course us humans with the issues. Let's be really, really clear.
So I kind of find that to be a myth, that animals hide their pain because
we just need to listen better.
We need to observe better. Yeah. And I use this example when I talk to students a lot. I say, who in here has a headache? And a few people will raise their hand. And I go, how many people knew they had a headache before they just raised their hand? right? And maybe a hand or two will go up. It's usually the person sitting next to him because they've said something to that person,
Right.
right? And I then will say, well, how many of you would have known they had a headache if they didn't tell you? No hands go up.
Right.
Because observing pain is different. Observing pain is different. So, you know, and one of the things the students and I just talked about was, you know, in human medicine, they've identified, they've looked at mild, moderate, severe pain. What do people report? And when I talk to clients about it, I say, think about it in terms of a headache, because most people can understand having a headache. They might not be able to understand, you know, a chronic pain in another way, especially if they're 20-something years old, your client. But they've had a headache probably at one point in their life. So mild headaches, what do? They continue to live their life. They still go to work. They still do things. You know, it doesn't really affect their life that much. When it gets to be moderate, there's some mild changes in behavior. When it gets to severe, there's severe changes in behavior. Right? When we have a severe headache, we're in the bed and under the covers and in a dark room, and you know, we're doing some major changes to our behavior. We usually pull drugs when we're in moderate pain. So understanding that there are different, you know, everything that we're talking about is coming from the perception of the human and not the perception of the animal. So if we're looking at animal behavior, are they changing their behavior? Could they still be in pain? Yes. Right? If they're changing their behavior, they're at least in moderate pain, according to humans.
Right. Right.
And
it's hard to know, like, my dog happens to be, you know, struggling with this like cyst in her paw, and I can tell that she's struggling with it. I guess my question is really, how much is she struggling with it, and how can we really know that, right? I think that's part of the trick, is like, when you start to observe it, is that then, okay, it's severe, or it's, you know, let's be really clear, there's a squirrel, she's still running, right? So
I would say, you know, it's between mild and moderate, because she's still able to do things she would normally do. If it was severe, she would stop doing that.
Right. Even for bacon, probably wouldn't run.
Maybe.
So maybe. So do you have, you know, how do you have sort of steps or suggestions, like if there are, you know, veterinary colleagues that are looking to kind of find more interest in palliative care and think this is something that they want to help their clients with, are there, like, how do they help clients identify goals for caring for their pets around palliative care? Where, as a veterinarian, do they start?
Well, we could go on and on all day.
Okay, let's do the shortened version, and then we can definitely, as always, we'll put links in the episode notes, so we'll have a lot more information available. But we don't want to keep these too long, because then nobody will ever listen.
Right. So, you know, in general, what I say is, if you've made a diagnosis that is chronic and progressive or terminal, you should be starting palliative care at that moment. If you're not comfortable with starting palliative care, you should refer to a palliative care veterinarian. There's not a lot of us out there. Most of the people who are doing end-of-life care are doing euthanasia only or mostly. But there are a few people out there that are actually doing palliative care. You know, that's number one. For veterinarians, they should start immediately. The two, I would say, getting more information about, and I have a book coming out, so I'm gonna say maybe let's, you know, that will help. I have a nerd book chapter, I think, coming out as well.
Yep, we should say that the nerd book is a part of the VIN Foundation, and so we have a lot of amazing, wonderful veterinarians working on updates all the time.
Yeah. So I haven't heard in a while. I don't know what the timeline is there, but hopefully my
We're working on it.
Okay, all right.
All right. I assure you it's being worked on. It is a weekly ongoing effort.
For clients, I would say, if their pet has been diagnosed with a chronic, progressive, or terminal illness, then they need to start looking into palliative care. Specific steps. I mean, there's all sorts of things that you can do for palliative care and palliative medicine, but to know when they need it, it should be at the beginning. If you haven't done it at the beginning, let's say you just think as a client, your dog's getting old and they're slowing down and not doing the things that they used to do, and you just feel like they're old, then that would be a time to maybe consider talking to your veterinarian about some palliative care. Maybe they need additional support. Maybe you need additional support. I mean, a hospice being just the end stage of palliative care is, maybe they're at that point. I don't know. If they're at that point, maybe they need more information about disease trajectories and, what dying looks like, and, pain scales, that sort of thing. So there's all sorts of things that they can specifically do talking with their veterinarian. But I think the number one thing, if you have a dog or cat or horse or goat or fish or tarantula,
equal opportunity animal.
Yes. Mosquito, if you have those as pets, I don't know.
Cockroach.
Whenever I philosophize about whether there's life after death, I always think, but what about cockroaches?
Yeah, exactly.
Do they have consciousness?
There you go.
So, what about ants? I mean, I have a lot of ants in my kitchen sometimes. Am I sending them on
Is there palliative care that I can offer them?
I can offer them euthanasia. All right, so that's kind of I think that's the number one step is to if you're at that point, start it now. So that's kind of where I would start.
And if colleagues are interested in learning more about palliative care, we'll put some links in the episode notes so that people can learn more and read more. I really appreciate first of all, your dedication to this area of the field. Thank you so much for trying to make our animals' lives better throughout their life. Yeah. I remember when I got my dog, and I rescued her at 3.5 months, and people said to me, "Oh, you're so lucky she's a puppy. Like, I wish mine was a puppy." Oh. And I just thought, like, oh, I mean, I wish mine was a puppy every day, because that way I get more time with her. But I also just want to appreciate her at every stage of her life, right? And it's so often that people tend to really want shiny new things, right? And really, these animals are amazing creatures throughout their whole life. And the more that we can do to help provide comfort and enjoyment for them, I think is so important. And especially when you see these numbers coming out of COVID of people that adopted animals and now are going back to work, and the struggle animals are having because of that. And just remembering that they are these beings that, from a pet owner perspective, being aware of that. And then I so appreciate that you're taking the time and effort and have the passion for this so that we can all learn how we can better improve animals' lives. Because that's the mother lode. That's what we're all here for, right? Is to do everything we can to help these animals that we deeply, deeply, deeply love. So I want to, we try to keep these not too long so that ideally people listen. But there is one question that I always like to ask people at the end, and that is, do you have a secret talent or something that you enjoy doing that other people might not know about? Because I find this is something that I ask these questions, and sometimes I think like I know the person pretty well. So I'm like, oh, for sure I know what they're going to say. And it's never the answer that I think. So.
I can say a lot of things, but I will say that I love Star Wars. I also love Star Trek. So I do both, but I sew and I costume. So I make noble outfits for Renaissance fairs. I've made 1800 type outfits for Dickens Fair. I've made Jedi outfits for going to Disneyland. So I've done a lot.
Oh my gosh, that's so cool. Yeah. That is so cool. What a great talent to have. That's very impressive. And again, it was like, choose something that you think you might know about Lynn. I mean, we've just relatively met, but that's still, I love hearing these things. Yeah. So thank you so much, Lynn. Thank you for your time and effort. And again, really your dedication to helping the animals that we love. And it really, it's really an impressive and courageous path. And thank you for being willing to be brave and have, the courage to share your story with us. There's a lot of touching aspects there and ones that I know are not easy. And I really, really appreciate your time and effort. So thank you so much.
Well, I appreciate you having me on. Thanks, Jordan.
Thank you.
Thank you for joining us for this episode of the Veterinary Pulse. Please check the episode notes for additional information referenced in the podcast. If you enjoyed this podcast, please follow, subscribe, and share a review. We welcome feedback and hope you will tune in again. You can find out more about the VIN Foundation through our website, vinfoundation.org, and our social media channels. Thank you for being here. Be well.